Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now here is the founder of LTI and your host, Dr. Jason Roundtree.
How you been, Christy?
Doing well.
Good.
You?
Good.
Busy?
Yes.
Yes.
Quite busy.
Busy is good.
Busy is good. There's really nothing to be gained from sitting around.
No.
In most cases. A little bit of rest time can be good, but not too much.
Well, body in motion stays in motion, and then it just goes from there.
Yes. Yes.
So.
You're back to running, right?
I am.
Did you run today?
I did.
Did you?
Before the sun was up.
It's a perfect morning.
It was a great morning. So, love it.
Body in motion stays in motion. That's right. We're actually talking today about keeping people in motion, keeping things doing well, and essentially PRP as a method to do that. But this is the Laser Therapy Institute podcast, not the PRP Institute podcast. So we're going to talk about how to utilize light and laser therapy along with PRP. And I think this will actually be pretty valuable to a lot of people, because if you do laser or light therapy in your clinic, you're probably going to see patients who have had PRP done. And if you do PRP in your clinic, you should be doing laser therapy as well. If you are doing regenerative medicine at all, any kind, whether it's bone marrow concentrate, PRP, prolotherapy, really any of these, you should be doing laser therapy as well. So today we're going to focus on how to operate your laser in conjunction with PRP. I have a 3-step process for you that we'll get to at the end. I think it'll be pretty useful. This is not going to be us making clinical recommendations. This is not us telling you what you should be doing in your practice. You have to decide that on your own as a healthcare provider. However, we're going to look at some research that is pretty interesting, very new research that I've kind of combined here to come up with what could be future recommendations for using light therapy in conjunction with PRP. So we'll get into it right now. I'm joined today by Christy. Christy is a certified laser tech, has been doing laser for years and years. She's also the lead developer of our online learning materials for Laser Therapy Institute. If you're a healthcare provider, you're looking for laser therapy training, you're looking for settings, protocols, things like that, we can hook you up. A lot of it is online training. You could start today.
Very true.
Very true.
Very true.
And it's good stuff, too. Christy won't tell you, but she does a great job putting this stuff together. So, my name is Jason Roundtree. I'm a chiropractor, and I'm also a certified medical laser safety officer. I'm the clinic director of a multidisciplinary clinic that works on pain and aesthetics, including PRP, hyaluronic acid injections, joint injections, laser therapy, laser aesthetics, some other stuff. So.
And the brains behind all the training that we put out.
Yes. Unfortunately for everyone that works with me, they have to translate all the things that fly out of my mouth and to actual usable material, but they do a great job doing it. So, stick with me here. We're going to get into this right away. So, PRP. What is PRP? Do you know what PRP is, Christy?
I know it's a blood, it has to do with blood and transfusion, not transfusion, but I don't know I cannot tell you what PRP stands for.
Perfect.
But I do know that it has to do with blood.
It does. Okay, great. So I was hoping you wouldn't spout out a really awesome answer and then show me up. So PRP stands for platelet-rich plasma. And essentially, you're exactly right. It's blood. We're taking blood from the patient, you're spinning it, and then there's a couple different ways to do this, but essentially you end up separating out the platelets. And you put those, kind of reconstitute those with a little bit of plasma. And what you get is a higher concentration of platelets in this small amount of plasma. And then those platelets are able to be delivered to whatever part of the body you're treating, whether that's a soft tissue condition or a connective tissue disorder or a joint arthritic condition, whatever you want to work on, essentially. And these are being used for all kinds of things. I mean, in the last week, we've done injections in the SI joints and facet joints in the low back. We've done Achilles tendon. We've done knees. And that's just here. And so this is actually becoming more and more used across the country as well. So the great thing with PRP is it's the patient's own product. right? So you don't have any kind of rejection issues. It's extremely safe. You can draw, prepare, and re-inject that material within about 30 minutes or so in most cases. And if you're good with it, you can actually play with the concentrations of the PRP to get the right level of concentration for that patient. And then, of course, typically guided injections to deliver that material exactly where it needs to go.
And that was going to be my question or my clarification, is it's just a concentrated form of their own product really delivered to a site-specific area to increase the regeneration?
Right. Yeah,
Okay.
That's exactly right. So platelets have a lot of intercellular signaling capability. Essentially, they detect damage and they activate to bring in more irritation, more inflammatory processes, which is the first step in healing. You need that.
Right.
And it also controls some of the negative effects of chronic inflammation. So when we do a PRP injection, what we typically see is a reduction in pain gradually over a couple of days, followed by a consistently, over about a 4-week period, consistent progression in terms of the patient's success and reduction of pain, improved strength, improved capabilities, things like that. Again, depending on where we're treating. So, in a lot of cases, you'll see PRP studies out there with some mixed results. Sometimes PRP to some researchers means like a 1x concentration, which is just plasma with regular platelets. So that's not really platelet-rich.
Right.
Sometimes it's only a 2x concentration. A lot of people, though, out there are using a 5 to 10 times concentration of platelets. So this is close to 1 billion platelets in some cases that are being isolated and injected into this area, and so that can really stimulate a lot of repair. So I'll just go ahead and read this. So PRP is a concentrated solution of platelets, growth factors, signaling molecules, and other plasma proteins that play vital roles in orchestrating tissue healing and joint stabilization. So your body does this on its own. When you get a cut, it clots, right? That's the initial action of platelets, and then they stimulate that ongoing repair. This doesn't really happen in a lot of connective tissues. Do you know why?
No.
Because they don't have much blood flow.
Gotcha.
Mm-hmm.
And it
So-
had to do with blood.
Yep. Has to do with blood. That's the whole thing we're talking about this time. Yeah. So if you don't have blood flow to an area and it gets injured, then what happens is the injury just sits there and doesn't really do anything. Those platelets, the blood flow itself is not getting there to stimulate that repair process, or very little is. So the idea is you're taking the body's materials and just putting them where they are supposed to be going to do this repair. So platelets have tons of growth factors, which are released at the site of injury, and then they continue to signal and they call for other healing factors to be drawn in. It's very quick, it's very safe, and because it's really natural, it's great. So compare that to cortisone.
And from my understanding, cortisone breaks things down rather than repairs. Really?
Yes, essentially, yeah. It does stop an inflammatory process, but again, the inflammatory process is part of healing. And we know now, really, really consistently, we've seen that cortisone actually deactivates important cells like chondrocytes that build up cartilage, right? And so if injecting, especially repeated injections of cortisone, does do damage to joints and connective tissues. So good thing to stay away from, and if we've got an option like PRP, that can be helpful. Now, there's a couple of studies out there that indicate that PRP effects can actually be enhanced by using lasers and light. Not surprised, because laser therapy stimulates the body's natural healing process. So, pairing these together seems like a natural thing, but we don't like to just go off of feelings. We want to see the studies, right? So, the thing is that once blood is removed from the body, it's a kind of a traumatic process. So the draw process itself puts a lot of shear forces on platelets and red blood cells, and it actually does some level of damage to the blood. Now, it's not a huge amount, but it is some level of decreasing the potential of that specimen. As you're drawing the blood, you're doing some level of damage to it. Also, you do use an anticoagulant, like sodium citrate, when you draw blood, but there's still some level of clotting that can happen even in the needle as you're drawing that blood. And the clotting deactivates in a way, those platelets, or kind of prematurely activates those platelets, which is not something you want if you want to get those platelets delivered to an injured site, right? So what you can look at doing is using light therapy to reversibly inhibit the platelet activation. So at this point, we know that applying light to the whole blood kind of puts those on pause. It almost like puts them to sleep. So you do
activating. The light therapy before withdrawing the blood?
You do it after you have the specimen.
Gotcha.
While it's in the body, it's not really something you can treat necessarily. Mm-hmm. You could apply light to the vein above where you're drawing. But this particular study that I'm referencing here, they drew the blood and then they lit the blood up.
Okay.
Mm-hmm.
Okay.
So they pulled it out, got it in the syringe, right? Mm-hmm. Put the light on it because you usually have a clear syringe, so you can apply light therapy to that syringe. And they saw that it leads to clear anti-aggregation effects or less clotting. And then that discontinuing that leads to the cessation of that effect on platelet aggregation about 30 to 60 minutes after the end of doing the light therapy. So you can pull the blood, light it up, and you've got 30 to 60 minutes where that is more stabilized, where you don't have platelet aggregation and lysis, right? Mm-hmm. Which means you're preserving more of that platelet population for the injection you're trying to do, right? Because it's going to take 20, 30 minutes to process that blood.
Because you're spinning that blood to separate it.
Exactly.
And so you're keeping it alive, basically, while it's spun.
Mm-hmm.
Okay.
Yeah.
Interesting.
Yeah.
Yeah.
So if you inhibit that, you lead to, more of the platelets being ready. It doesn't actually change the platelet count. We're not increasing platelets. We're just preserving what's there, and to the point that it doesn't reduce the total platelet count. Even hours of doing photobiomodulation on the blood can actually preserve that for several hours.
Wow.
You don't really need that for PRP. You just need 30 minutes or so.
Yeah.
So to really just hitting it with some light can do quite a bit.
Interesting.
And then because it's temporary, once you've injected it, they start kind of waking up, and then they get to work.
Get to work.
Mm-hmm.
It's like nap time's over.
Right? Yeah, exactly. So that's the platelets, which are important. But then the other side said, you got red blood cells that can lyse. They start to kind of fall apart because of some of the forces involved with the draw and then the processing and so forth. And so this study actually says the high shear forces during specimen collection can liberate harmful hemolytic hemoglobin components from disintegrating red blood cells, leading to oxidative stress. Oxidative stress is a process that damages cells, right? And so putting a bunch of oxidative stress on the cells you're about to try and separate is generally not a good thing. Plus, if you lyse these red blood cells, then you're letting these cellular components just free into the plasma. And so when you do your centrifuge process, you're going to separate red blood cells and the plasma. But if you've lysed a bunch of those red blood cells, you've got red blood cell components now in your plasma. Mm-hmm. And that's bad because oxidative stress means inflammation. The more inflammation that you allow to happen or cause to happen with your injection, the more painful the injection is.
Interesting. Okay, because that's a lot of stress even in the centrifugation process on the cells and
right.
So
yeah, exactly. So you want to avoid red blood cell lysis when you're doing your PRP process, and so there's different ways to do that, but really you can't avoid some of the inflammatory oxidative effects that happen even just from doing the draw. And then over the next 20-30 minutes, especially if you're doing like a double spin technique, which seems to be about the best. You spin it once, separate it, spin it again to separate, to concentrate the platelets, and then draw off enough plasma that you can really concentrate it. If you're doing that process, there's a lot that has to happen, and so you want to avoid as much of these inflammatory hemolytic pieces like getting into your plasma as you can. If they do lyse, if these red blood cells do come apart in this process, it also releases platelet activating factor. What do you think that one does? Platelet activating factor.
It gets things going.
Yeah, it activates your platelets, which we don't want.
No.
Until
it's
they're
going back into the body.
Exactly. So we don't want that. We don't want platelet activating factor coming out. And also, it releases macrophage migration inhibitory factor, which is a really, really strong inflammatory cytokine. And like we said earlier, a little inflammation caused by the platelets is an okay thing. We don't want the red blood cell caused inflammation, because that is much, much more potent. It's too much. And so that's where you'll get people that have a lot of pain after a PRP injection. It can still accomplish very good things, but a really good PRP injection should not have a lot of pain afterward, or swelling or redness. So if you're doing PRP and you have a really large amount of inflammation right afterward, then you probably have a not ideal process. You're probably getting some red blood cells, some white blood cells in the mix. Maybe you're lysing some of the red blood cells, and that's creating this inflammatory response. Really, everything should be pretty settled after a PRP injection in most cases.
So would that be done in the centrifuge process, or, I mean, how do you remedy that?
Yeah, well, it turns out laser helps to head that off.
I was planning that lead.
That was actually very good. So just to quote this study again, those factors, the macrophage migration inhibitory factor and platelet activating factors, those might ultimately lead to secondary inflammatory conditions further downstream. And there's a huge amount of the macrophage migration inhibitory factor within the red blood cells. So you really don't want to lyse any of that, or as little as possible. So they say physicians should choose the prep method that safeguards that biologic. Okay. Additional research, different paper now, says that near-infrared photobiomodulation limits red blood cell lysis. So they should have more excellent resistance to osmotic stress. Osmotic stress is a fluid-based stress of exchange, right? So if you can minimize that stress, you're going to limit the amount of red blood cells that actually get torn up.
Okay.
Now what we're going to do, this is like 5 different studies here. Thank you for your comment, Jerry. This is like 5 different studies. I'm going to drop links to all these. And actually we're putting this into a blog post that we'll publish here. It should be in about an hour. So you can actually read this as well. And you can go through and look at those links also. Okay, so if we can light up the blood, the whole blood, right after draw, then you're going to help to put those platelets to sleep, and you're going to protect the red blood cells from being lysed, which means you're going to come away with a more pure platelet-rich plasma product with less of those red blood cells and red blood cell products in there, which is good because you're going to have less inflammation. And you're also going to have platelets that have gone to sleep rather than trying to activate, that then become activated once they get into the tissues.
Right.
There's one more step, though. We can actually activate those platelets with light after we've spun them down and we have it ready to inject. So you take your final product and you can apply light, because they say in an additional study here that photobiomodulation can be used to enable sustained growth factor release, which is exactly what we want from PRP. We want that sustained release of growth factors over time. So after applying light to PRP, the researchers saw that ATP secretion, calcium release significantly increased, and that you also got some additional factors of growth released there too. P-selectin expression was increased. In conclusion, PRP was successfully activated with light and then realized activation-dependent sustained growth factor release over a 28-day period. So that's about 4 weeks of sustained growth, which is exactly what we're trying to go for with PRP. And that's, there's a lot of studies out there that do show about 4 weeks or so, 4 to 6 weeks of sustained growth factor. But if you can use your light to stimulate more and more reliable growth factor release over that 4-week period, well, then you're getting more out of your PRP injection.
Right. Now that continued light therapy is on, the patient comes back for that.
Actually, this one, the factor we're talking about right here, is a single time exposure of lighting up the actual product before you inject it.
Okay. So you light it up after you withdraw. You light it up before you inject it. So it's all in the vial that you're...
It's all there. Yep,
Gotcha.
It's all in the syringes you're using or whatever containers you're using. It's actually very easy to do this and pretty quick. So let's talk about this, because you already got to the 3rd step, which is using laser afterward right there. That's exactly right. So 3 steps here that you can take. And again, we need more research on this. This is just all very preliminary. And we're not going to sit here and make recommendations to a healthcare provider about exactly what you should do. this is just interesting stuff that probably in the future we'll see borne out. So far, this is what the research is kind of looking like. Step 1 would be a blood draw completed, and then immediately using photobiomodulation on that whole blood before you do anything else to it. And obviously, you're going to have your anticoagulant already in the tube, but you can go ahead and as soon as that draw is done, go ahead and expose it to light. You need to have a wavelength somewhere between 750 to 1100 nanometers. And you need to be using about 1.5 milliwatts per centimeter squared for your power density. Total dosage of 1 joule per cubic centimeter. So not centimeter squared, we're talking about cubic centimeters, because we're talking about blood volume. The second step is after you've gone through your centrifuge process and your multiple draws and you have a PRP solution ready for injection, there you're going to go ahead and light it up again. And this time you need to be between 600 and 1200 nanometers for your wavelength, about 5 milliwatts per centimeter squared in your power density, and between half and 10 joules per centimeter squared, which is going to be kind of difficult to calculate. So unfortunately, that's what we have right now from the research, and it's a big range. Half a joule to 10 joules per centimeter squared. So you have to figure that out in terms of what volume you have and how to translate that into square centimeters versus cubic centimeters. But that's all we have on the research specifically right now. I do have additional recommendations for our LTI members that we'll be talking about here next month in our monthly member chat. But this is what the research is showing, so it's best I can give you today. Third step is to apply standard dosage photobiomodulation in the region of the injection after the injection. So, number 1, light up the whole blood. Number 2, light up the PRP right before you inject it. Number 3, use light right after the injection to continue to stimulate that factor. And then you already alluded to ongoing light therapy in that 28-day period to continue stimulating more and more growth. That is how you're going to get the most out of PRP according to the research we have right now. We are going to learn more. There's more and more coming out. I mean, these studies were from this year, from March of this year. 2019, 2020, 2018. So we're going to be learning a lot more about this in the not too distant future. And that will help to guide some of these decisions we can make on parameters and exact stepwise decision making there.
But you already alluded to even, LTI members will kind of get more information.
Yeah. So the thing that's great about LTI is we're a membership organization, so we get together once a month and discuss the latest research, what each of us are seeing in practice with light therapy, and it allows us to get a little bit more on the leading edge of what's out there. Again, we're not going to make recommendations for a patient or for a healthcare practitioner to follow blindly, but this is really interesting stuff. We can discuss it kind of in a team, and then we see what each other are doing, we see what works out well, we see what doesn't work out well, and that's been extremely beneficial for the patients of our LTI clinics.
But this is exciting stuff.
It really is.
It really is good.
If you want to know more, go to our website, lasertherapyinstitute.org. You can also follow this podcast. If you don't mind, if you enjoyed today's episode, please scroll down. If you're on an iPhone, give us a rating or review. That helps us get the word out there to more physicians and healthcare providers who are providing light and laser therapy. And if you have additional questions, you can always catch us on email, info@lasertherapyinstitute.org. Christy, thank you very much for joining me.
Thank you for bringing the research to us.
Every other week, I will do my best.
Yes.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.